Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to the second part of the lecture talking about nociceptive pain. So as I mentioned earlier, nociceptive pain is related to tissue damage or injury. So when there's injury, there's an inflammation, there's a vasodilation is going in the area, and lots of cytokines, lots of chemokines, prostaglandins that would be produced in the area, calling for white blood cells, T lymphocytes, macrophages to come to the area, trying to control the inflammation here, trying to protect the injured site from infection and to promote healing of the area. These chemokines and cytokines, prostaglandins, will all be detected by the free nerve endings. Remember that we talked in the last part that there is specialized receptors responsible for detecting pain and transmitting these pain signals from the periphery to the central system or central nervous system. So here are the nerve endings that would get this triggered, get this signal, and will initiate an action potential. This action potential will move into the nerve fibers, moving up to the higher centers in the central nervous system. There is a synapse that would occur in the central nervous system or at the ganglion, at the trigeminal ganglion. So we are here talking about the trigeminal ganglion because we are talking about the facial pain and dental pain, which are all supported or innervated by the trigeminal nerve. So here at the synapse, there would be transmission of the signals, and this occurs through the ionic stimulation and different neurotransmitters that would be responsible for transferring the signals from the periphery to the higher centers. Once we are here in the higher center, it will get to the brain. So once in the brain, in the somatosensory cortex, then the patient would feel the pain, or there would be an experience of pain. Only when this signal reaches to the cortex of the brain. As I mentioned before, there are different sources of pain. It could be pulpal pain, it could be periodontal pain, it could be gingival or within the bone where there's, for example, a dry socket after extraction, or pain associated with denture base due to injury or trauma. So there are different sources of dental pain, let's say. So when we are talking about dental pain, it does not always refer to pulpal pain. This is one part of the pain, one part of the dental pain. It could be periodontal, it could be gingival, or it could be in the bone, or associated with the dentures or with different prostheses. So our topic would be mainly concentrating on the pulpal pain.